Hello students, so we have finished the CPT guidelines and from today onwards we'll start with the ICD-10CM. So this comprehensive guide will walk you through the essential steps to learn the medical coding effectively and provide a clear path to start your career in healthcare data management, regardless of your background or experience. By following these steps, you can confidently begin your journey into medical coding, develop a practical skill in healthcare documentation and classification, and unlock diverse career opportunities in the medical and health information technology industry. So let's begin with our ICD-10CM journey. Now, first, let us understand the full form of ICD-10CM, where the I stands for international, C stands for classification, D stands for diseases, 10 is the 10th revision, and CM stands for clinical modification. It's a highly detailed and standardized system used in the United States and many countries for healthcare system to classify and code medical diagnosis and other health related conditions. So let us understand what is the purpose of the ICD-10CM. ICD-10CM helps in collecting the data which is used by the public health organization, researcher and policymaker, and they can analyze that data and they can interpret the data also, and it helps in tracking the diseases prevalence and trends, monitoring the public health issues, evaluating and effectiveness of the treatment and interventions, allocating the healthcare sources, studying healthcare costs, and investigating and preventing the fraud and abuse. So ICD-10CM, it is the clinical modification of the ICD-10 specifically adopted for use in the United States. The National Center for Health Statistics, which is a part of the CDC, is responsible for developing and maintaining ICD-10CM with authorization from the WHO. So now let us understand the ICD-10CM manual and the 7 key sections. I have arranged them in the chronological order or the way you will find them in the book. The first is official guidelines for coding and reporting. Second is alphabetical index to diseases and injuries. Third is neoplasm table. Fourth is table of drugs and chemicals. Fifth is external causes and causes index, tabular list of the diseases and injury, that is 6th, and 7th is Z codes and special purpose codes. So the first section is official guideline for coding and reporting, where you will see the rules and conventions that guide how to assign the code correctly. The guidelines are divided into 4 sections and 1 appendix. We will be studying section 1 in detail. The section 1 which consists of convention, B general guidelines, and C is a specific chapter specific guideline. Then there is the section 2 which is selection of the principal diagnosis. Section 3 is reporting the additional diagnosis, and section 4 is outpatient coding guideline. This we learn for the advanced coding, but this is must for all the coders to understand. So this is the table of content where what is there in the book is written. The chapter 22 chapters which are there, they are properly written. Then the appendices, illustration, and then there is the neoplasm table, table of drugs, index to external causes. Everything is written in the table of content. So let us understand what the convention means. Under the section 1, we begin with the section A, that is for the conventions. ICD-10CM conventions are nothing but the set of instructions regarding the symbols, abbreviations that we use within the ICD-10CM manuals. And there are 19 conventions. So pay attention to that, and it is there written in your book like this. Then point B is the general coding guideline. The general coding guidelines are the broad rules and the principles that apply to the use of the ICD-10CM coding system across all chapters and categories. They provide instructions, and there are 19 general coding guidelines. Now comes the C in the section 1, where we talk about the chapter specific coding guidelines. These are the special rules and the instructions that apply only to certain chapters or the categories of the diseases and the condition. They supplement a general coding guideline and provide detailed instructions for coding diseases found in particular body system or condition like infections, neoplasm, pregnancy, and injuries. Then we come to the alphabetical index to diseases and injury. It is the A to Z listing to look up the main term for condition. So the alphabetical index is alphabetically arranged list of the diagnostic terms and the condition found in ICD-10CM manual. It helps to the coder to locate the correct code by first searching for the main term describing the condition or the diseases. In short, it's your starting point for finding the right code. You never assign the code directly from the alphabetical index, but you must always verify it in the tabular list. So every word is very important. So have a look at this, and it looks pretty much like your English dictionary. So the section third is a neoplasm table. It is a special index to find the codes for tumors and cancers. So the neoplasm table is a special section of the alphabetical index used to locate the ICD-10CM code for the tumors and neoplasm. Uh, and they are divided depending upon the anatomical site and the behavior. So this is the anatomical site and these are the behavior, whether it is a malignant, and if it is a malignant, whether it is a primary, secondary, carcinoma in situ, benign, then uncertain behavior and unspecified behavior. So it helps the coder assign the most accurate diagnosis code for the cancer, tumors, or the abnormal growth. So the next comes the table of drugs in the chemical. The drug table, officially called the table of drugs and chemical, is a special section of the ICD-10-CM alphabetical index used to identify the codes for poisoning, adverse effect, underdosing, toxic effect of the drugs, medication, biological substance, or the chemical. So you will see the substances or the name of the substances are written, and here you will see that some columns are for the poisoning, then there is a column for the underdosing, adverse effect, and so this is the table of drugs. Section 5 is external causes index. The index to external causes is a special section of the ICD-10-CM alphabetical index that helps coder find code describing the cause, the place, and the intent of the injuries, poisoning, and other external event affecting the person same. It is used to explain how an injury or the condition happened, not what the medical condition is. And this index is after the table of drugs and the chemicals. And then comes the tabular list of diseases and injury. The tabular list is a numerical listing of all ICD-10-CM codes arranged by code category and a chapter. It is alphanumerically arranged and contains essential instruction, notes, and guidelines for accurate coding. The tabular list is where you verify and assign the final code. You never code directly from the alphabetical index alone. So this is very important. And the last but not the least, that is the Z codes and the special purpose code. It starts with the letter Z or Z found in chapter 21 of the ICD-10-CM tabular list, and it helps track preventive care important for billing, statistics, and public health data. So this is the chapter 1, factor influencing the health status and contact with the health services. They are the Z code or Z code. Now let us understand the structure of the ICD-10 code. So as far as the ICD-10 code is concerned, it is a diagnosis code, and it is in between the 3 and 7 characters in length. So you will always have the 3 character, and then there is a decimal point, and then the code may have the 4th, 5th, 6th, and 7th character depending upon the particular condition. So these three, the first three characters, every code has, which is called as a category. And the fourth, fifth, and sixth character, they mainly talk about the etiology, anatomical site, severity of the illness, and then the laterality. And the seventh character is the specificity. So this is how the code is structured. So this is in short the structure of the ICD-10CM code. So, so just to give you a brief idea how the code looks like, this is the category, which is the injury of urinary and pelvic organ, and the subcategory which talks about the etiology or anatomical site or the severity of the illness and the laterality. It is in this section after the decimal point. So it is talking about injury to the kidney and whether it is injury to the right kidney or the left kidney, that is also specified. And every time you can see that there is a the note which is written here that will help you to add the additional digit, because how do I know whether this code has 4 digits? So here if it is written fourth digit, that means this particular code has a fourth digit, and after the 3 digits there is a decimal point, so I am adding the fourth digit. But here again there is the instruction that this particular code has a fifth digit, so I come here. Now after writing this code also there is a requirement of the sixth digit, so I add the sixth digit. And here there is a 7 digit, so where is the 7 digit? So here you will see the instruction box where it is written the appropriate 7th character is to be added to each code for the category is 37. So if the patient has an injury to the right kidney for the first time, I will write this. So it is that specific whether it is the first injury. It also talks about the laterality, and it also talk about the anatomical site, which is kidney. So this code is very, very specific, which talks about everything. Now, the best way to understand what we have learned is to do the practice. Patient has a hyperlipidemia. So, what is the first step? Look up the main term in the index. Main term means what is the main term which I am going to check in the alphabetical index, and that is hyperlipidemia. Then, so what I will do is I will come to the alphabetical index and hyperlipidemia. Your spelling should be correct. And I come down and I check hyperlipidemia. This is the main term. Now find out the code. What is the code? E78.5. Then what is my next important thing is go to the tabular list, find out if the code needs additional character. Irrespective whether code needs or not need, it is mandatory for every coder that once he finds out the code in the alphabetical index, they should pick up that code and go to the tabular list, because alphabetical index will not give all the character required into that code. So I will pick up that and go to the tabular list. Now I have come to the tabular list. Now the tabular list is arranged in the alphanumerical order. So you will see E78.3, 78.4 and E78.5. And that was the code which we have zeroed down. So it is written hyperlipidemia unspecified. And gladly there are no other characters and there is only one code. So that is the code for this particular patient who has a hyperlipidemia. The code is E78.5. Now, what is the main term? Now, as far as the main term is concerned, the main term could be the eponym. Eponym is basically whenever the main term ends with the apostrophe S, like the Parkinson's disease, Alzheimer disease, so that could be the main term. Or it could be the clear diagnosis, like the patient is having hypertension or diabetes mellitus. Or it could be the descriptive phrase like the patient is having food disorder or patient is having ear infection. So all these are the way the doctor will address the main term. Now, let us take first example. The patient is having acute bronchitis. So if you ask the question, what is happening to the patient? Bronchitis is happening. Acute can't be happening. Bronchitis is happening. So the bronchitis is the main term. Second is the patient is having chronic kidney disease. What is happening to the patient? Disease is happening. to the patient, not the chronic, not the kidney. So what are the chronic and the kidney, or what is acute? These are called as a subterm. So the bronchitis is happening, but what is the nature of that bronchitis? It is acute. What is the nature of this kidney disease? It is chronic. The patient is having lung infection. What is happening to the patient? Infection. What kind of infection? Lung infection. So lung is a subterm. The patient is having chronic coronary artery occlusion. What is happening to the patient? Not the coronary, not the artery. It is the occlusion that has happened to the patient. Coronary and artery, these are called as the subterms. So I have given certain example. Or the patient is having Marfan syndrome. Now this is a eponym because there is apostrophe s. So in this case, either you can see it under Marfan or you can find it in the syndrome, because what is happening to the patient, there is a syndrome. So I can either take it syndrome, or if I don't find it under syndrome, then I can go to directly the term Marfan. Then ulcer. So this is the main term, this is the subterm. Then what is happening to the patient? Fracture. What kind of fracture? Spinal. So it becomes a spinal fracture. So it becomes a subterm. So subterm is more specific to the main term. It gives more information about the main term. That is the subterm. So these are some examples of the main terms. Now let us take this example. Patient is having inguinal recurrent hernia. What is the main term? Hernia. What is inguinal and recurrent? It is a subterm. Now how to find out this? So this is a main term. I'll pick up that and I'll come to hernia. Okay. This is a main term. Now if you see, if you have the original edition, you will see that there is a main term and I can see these two gray lines here. So you will see that the first subterm is written here and then the next subterm is written here. So this is the hernia. What is the second one? It is a inguinal. So can you see here? Inguinal. Inguinal hernia, which is recurrent. Okay. So this is the subterm. So is this the code, or is this the code, or is this the code? So my code will be hernia, then I come to inguinal, inguinal with, what is it? It is a recurrent. So this will be my final code. So what is the code? K40.41. Now this is what I have found it in the alphabetical index. Now I'll pick up this code, K40.41. And what will I do? I'll go to the tabular list. So then I'll go to the tabular list. The tabular list is arranged in the alphanumerical order. So I will from A to K, and in K also 1 to 40, and in 40 also 40.1, 2, 3 till 40.9. And here I found a term K40.91, and it is written unilateral inguinal hernia without obstruction or gangrene recurrent. And this is what the patient had. So I will zero down this code. So let us take one more example. Patient is having fibrocystic disease of the right breast. What is patient having? Disease. So that is your main term, and you have two subterm, breast and fibrocystic. So I'll pick up the word disease. Under disease, I'll look for the organ that is breast. Under breast, I am interested in fibrocystic because there is a cystic, but I am interested in fibrocystic. And in front of that, I'm not getting a code, but they are telling me to go to mastopathy. Am I getting a code? No. Mastopathy cystic. So I come to the another main term, mastopathy, under that cystic, and I find the code N60.1. So many a time the alphabetical index will guide you to another term, and in front of that you will find a code. So what is the next step? We pick up that code and we come to the tabular list, which is arranged in the alphanumerical order N60.1, and which is saying fibrocystic disease of the breast. But here they are saying that this particular code has a fifth character. And if you remember, what was the diagnosis? The patient has a fibrocystic disease of the right breast. And we will come down, and here diffuse cystic mastopathy of the right breast. So N60.1 11 is our final code. Now, patient comes today for perforated acute bleeding peptic ulcer. So, what is the main term? What patient has? Ulcer. Now, there are many subterms in this particular example: perforated, acute, bleeding, and peptic. So, all these are the subterm. You can say peptic ulcer is also the main term, but ulcer is the main term. So, ulcer, under ulcer, there are various kinds of ulcer. We are interested in peptic. Under peptic, then you come to the next is acute or chronic, because we have two entry. So I am interested in acute. In front of that there is a code, but wait, it is not only acute, there is a bleeding also and there is a perforation also. So the hemorrhage and perforation. So we have the code K27.2 and K27.1. So now we need to check which is the correct code. So we come to the tabular list, and then we have the code K27.0, which is acute peptic ulcer with hemorrhage, but it is not talking about perforation. This is acute peptic ulcer with perforation, but in our patient it is both. It is the acute peptic ulcer with perforation and hemorrhage, and here it is without hemorrhage and perforation. So the codes are that specific. Now tell me what is the exact code. And yes, K27.2 is the right code, because in our patient we have both the conditions. So now let us come to another example: bronchiectasis with acute bronchitis. Now in this case, what is the main term? Main term is a bronchitis, and because of this bronchitis, the patient is having a problem with his airways, and the airways are permanently widened and damaged, and which leads to the buildup of the mucus and recurrent infection. So now we come to the bronchitis as the main term, and with we come down with the acute or subacute with the bronchiectasis. So bronchiectasis, and what is this? It is acute bronchiectasis. So we need to check J47.0, the code which we are getting it here. Now go to the tabular list. So tabular list, it is the J47.0 bronchiectasis with a acute lower respiratory infection and bronchiectasis with the acute bronchitis. Lower respiratory infection is also called as a bronchitis. So we got the code J47.0, and that is the code that we will take it. Now we find out what is influenza with a gastroenteritis. So now tell me what is the main term. The main term is, sometime you might say that gastroenteritis, sometime you might say influenza. Now let us understand. Suppose some of them they thought that influenza is a main term, and we look for it. So influenza with gastroenteritis, I am getting the code J11.2. Okay, now one group said, no, for me gastroenteritis is the main term. So look for it, gastroenteritis, and then you come down and you will see the influenzal, because it is a gastroenteritis which is influenzal, and it will direct you to see influenza gastroenteritis. So sometime by mistake also, if you have taken this as a main term, your ICD book will help you to go to the same code, because if I have taken the influenza, I was getting a code, but by mistake if I took the gastroenteritis, it was directing me to the same code, and then you found the code. And what was it? J11.2. So let's go and to the tabular list. The tabular list: J11.2 influenza due to unidentified influenza virus with gastrointestinal manifestation, influenza gastroenteritis, NOS. What is the meaning of that? That we will learn it in the next part. So here we finish the introduction of the ICD-10CM manual, and now we are going to go detail into conventions, chapter specific guideline and general guideline into my next part.